So we hear a lot about, and we see a lot of people with this condition called arthritis. I know that there are different forms of arthritis, but let's stick to the most common one, osteoarthritis or degenerative arthritis. Could you tell us a little bit about, is this something that we are all destined to get, or is there something that in arthritis that we can do to avoid it? And exactly what is arthritis?
So, starting with what is arthritis? Arthus means joint. Itis is inflammation of the joint. So, basically, it is the inflammation. And what is inflammation? It's a reactionary response of the body. So, your body responds to an irritation in the joints, and that is called as arthritis. Now, the irritation can be from many factors like infection, um, other autoimmune diseases, or osteoarthritis, which is what we will focus on. So, osteoarthritis is osteo is bone, arthritis we talked about. So, it's affecting the bones, but it's essentially inflammation of the bones, or the bones make the joints. So, it's essentially inflammation of the joints caused by a gradual wear and tear over time. Now, are we all going to get it? Yes, if we live long enough. It's rare. It's rare for somebody to have, but there are different grades. Just because you have some, if the doctor tells you, oh, you have arthritis, but you don't have any issues with it, you don't have any symptoms, then it's like saying you're old, but you say, yeah, I know I'm old, but I'm fine. So I would not worry about it being related to an age. It's a normal process of aging. Now, again, there's a spectrum. Some people get quite severely affected by it, and some people, it does not cause any issues. So not everybody is affected by arthritis. Almost I will say, everybody gets arthritis, which is a price you pay for living. So the issue comes as to uh, the how much it affects you, and what can be done to prevent it in one way. So, like we talked about, there's a general principles: keep your weight under control. We know heavier people are more likely to get arthritis. There are certain, if you see many people have, knock knees, they are kind of knock kneed. They're like, when they stand, they have their, legs pointing out. Some people are bow legged. When they stand, they're bow legged. They're more likely to get it. Arthritis of the hips is less common in India. Arthritis of the knees is very common in India. I think all my aunts, almost all of them have it. More, I would perhaps venture to say, I haven't read a study, but it's more common in females than it is in males. So we have wearing away of the joint surface. So if you see, the joint is basically two gliding surfaces make up a joint. And if you take the common example of a knee joint, it's just two gliding surfaces that go bend in this fashion. And when and to make that happen, there is a smooth, shiny lining of tissue that glides on another smooth, shiny lining of tissue, and it glides very nice. It's like a ball bearing. If you look at any nice little ball bearing, you find how nicely machined that is. That's how it is in the human body, except that it is nicely balanced with the ligaments and the muscles, and it gives you a very nicely balanced, stable movement, which is supported by the muscles around the joint. Now, if you keep the muscles strong, then that helps take away some of the load. And that's where bone health and exercise, stretching, they all come in. So the osteoarthritis, in short, coming back, is the wearing away of this cartilage over time, resulting in some amount of, sometimes as it becomes worse, it will result in some deformity. The biggest issue is of pain and lack and inability to function.